Hello everyone, welcome back to GrowMed. So I'm back with a series of the one-liner which are important for the Fmge, and all these one-liner are mostly based on the previous year questions asked. Okay, so as the exam is near, the date has also been announced that the exam will be conducted on the 12th Jan. So we should start our preparation with full pledge and should give our 100% so that we'll not be missing anything needed for the exam. So back with the one liner series, and after this I'll be back with a more interesting series like the buzzwords, then which will help you to make the clinical cases easy. Then images, I'll be uploading image based questions also. And for the practice of the MCQ, join the Telegram group. So all the links of the Telegram group will be given in the description box, and also the link of the other videos, so do watch all those things. So let's start our discussion for the today's video, that is one liners for the anatomy. So one liners, the anatomy, mostly the previous year questions, we will be discussing them now. Okay, so deep inguinal ring, this ring is seen due to defect in which structure? So defect in the fascia transversalis will be causing this deep inguinal ring. And from the deep inguinal ring, another important thing which you must remember is that there will be formation of the hernia. Inguinal hernia can be there present if there are some any other things associated with this. Okay, so defect in the fascia transversalis. Then the next question, the artery palpated between the medial malleolus and the calcaneal tendon. Which artery is palpated? So it is the posterior tibial artery, and image based question have also been asked on this one, the posterior tibial artery. So they will give the image of the leg. This is the image, and they can mark the artery, or they can just keep two fingers here and they'll ask which artery is being palpated here. So it is the posterior tibial artery. Quite famous question, asked multiple times. Then ossification of the talus occurs at which month of intrauterine life? So it is the 7 months. Okay. Then moving on, esophagus doesn't have which of the following layers? So we know that the GIT is made by 4 layers. Okay, serosa, mucosa, submucosa, and another one. So a layer from these is absent in the esophagus, and it is the serosa which is absent in it. Okay, so this one also was a PYQ. Then a patient presents with difficulty in shrugging the shoulders. So the nerve damage will be. This is an important keyword which you can find in the clinical case if it is given, and if simple one line is given, then also difficulty in shrugging the shoulder means the trapezius muscle is damaged. So two things, if they're asking the nerve, then it is the accessory nerve, and this accessory nerve will be supplying the trapezius muscle. So trapezius muscle will be damaged, and this also will be causing the difficulty in shrugging the shoulder. So two important things, muscle and the nerve. Moving on to the next, hypoglossal nerve injury will cause which lesion? See, because hypoglossal nerve, by the name only we can come to know that it will be supplying the tongue, hypoglossal tongue. So what will be happening to the tongue if this nerve is injured? Deviation of the tongue on the same side. Okay, deviation of the tongue on the same side. Sometimes image based question can also be asked, and in that image you can appreciate that the tongue is deviated to the same side. So they'll ask which side is injured. So if it is right side, then right hypoglossal nerve will be injured, and left hypoglossal nerve will be injured. Then the next question, in pleural tap, needle is inserted along which border? So it is the upper border of the rib, because you know in the lower border there is presence of the neurovascular structure. So to avoid injury to those neurovascular structures present in the lower border, we will be inserting the needle along the upper border of the rib. So very important, and this one you need to keep in mind during the clinical practices also. So that's why this is an important, asked in NEET PG also. Then moving on, the most common fractured carpal bone is the scaphoid. Okay, scaphoid is the most common carpal bone which is to be fractured, and the question they can ask in a different pattern, like most common bone fractured around the anatomical snuff box. So there's injury to the anatomical snuff box, which carpal bone is damaged? So associated with the anatomical injury also, anatomical snuff box injury also. So do remember this one as well in a mind. Then most common dislocated. So the carpal bone to be dislocated most commonly is the lunate dislocation and scaphoid fracture. Then injury to the long thoracic nerve, it causes winging of the scapula. Okay, so long thoracic nerve, winging of the scapula. Whenever you see these two sentences, winging of the scapula, then or long thoracic nerve, go with these as the answer. Likewise, same. This shrugging, difficulty in shrugging the shoulder, accessory, and the trapezius, similarly like that only. Then the highest point of the iliac crest is at the level of L4. L4. Image based question can also be asked for this. They'll give the marking of the vertebra. So this is the pelvis and this is the sacrum. So they'll mark this image and they'll ask what is the vertebral level. So it is the L4. Okay. Then skin of the first web space is supplied by which nerve? So it is the deep peroneal nerve which supplies this area. Then moving on to the foot drop occurs due to injury to which nerve. So foot drop occurs if there is injury to the common peroneal nerve. And another important thing, remember about this common peroneal nerve, that it is the most common nerve to be injured in the leg. Most commonly injured in the leg is the common peroneal nerve. Then moving on to the next question. So embryology. Embryology questions are also important, and frequently questions are asked on the ligaments, like the adult remnants and the adult derivatives. Like here the question asked was adult remnant of the umbilical vein. So umbilical vein will be remaining into the body as a ligamentum teres, asked multiple times. Likewise, they'll ask the remnant of what? The vitellointestinal duct, the persistent vitellointestinal duct. It will be causing this leakage of the fecal matter. Then uranthus. Then about the pharyngeal arches, the persistent pharyngeal arches, they also can cause a cyst. So this embryology part is also important, and you can note it down that from embryology one question will be short asked. So from the embryology cover all the important things. Then lacrimal gland is supplied by which nerve? So it is the pterygopalatine ganglion which supplies this lacrimal gland. Then moving on to injury to the paracentral lobule, which region of the body will be involved or affected? So it is the perineum and the leg. So if this is the brain, okay, let me do it. If this is the brain, then okay, one second. So this is the brain and this is the lobules, the lobes, and this one is the pons, and this is just a rough diagram. Okay, don't go on the diagram, just to explain you. So if we cut the section of the brain, it will look something like this, okay. So this distribution of the the nerves or the region which is controlled by the brain, here it is the ears, like it is in a reverse order from here to here. So the paracentral lobule comes somewhere here in the brain, and this area is controlling the perineum and the leg. So the area here will be controlling the face, then after that here the trunk, then here the fingers, and then here the abdomen and all, and here. So it is like this in a ulta way, you can remember, like from starting from here to here. Okay, so this is how the distribution of the control of this is there. So if paracentral lobule, perineum and leg. Then moving on to in Bell's palsy, which part of the face is paralyzed? So Bell's palsy also again a repeat topic and a must do topic. So you can expect short one question from this one, the Bell's palsy. Okay, so the injury which will be occurring in the Bell's palsy is that the face will be paralyzed on the same side and the same side, but depending on the upper motor neuron, on the lower motor neuron, it will be whole side of the body will be affected, or half side of the body will face, half of the face will be affected, same side of the face will be affected in case of Bell's palsy. Then injury to the bulbar urethra. So extravasation of urine happens at which region? So it is the superficial perineal pouch, superficial perineal pouch, and this one is also an important topic. So frequently questions are asked on this in integration with the surgery also. Perineal pouch, that a man was walking and he had fallen in the pat holes, so there was injury to the vulvar urethra, there is extravasation of urine where, and they can also ask question like injury to the urethra, blood at the meatus, so which part is damaged. So questions have been asked like this also. Then see, I would suggest that whenever a question is asked from a topic, like for example the Bell's palsy, read all the points related to the Bell's palsy instead of just reading that question, because if the examiner will try to confuse you or change the pattern of the question, then you can easily solve that question. Okay, so always prefer doing the topics rather than the MCQs. Okay, then blood supply to the tonsil. So the main artery which will be supplying to the tonsil is the tonsillar artery. Quite easy one liner, and from the option only you can easily rule it out. Tonsillar artery. Then the cartilage that doesn't ossify is the epiglottis, because epiglottis is constantly in use, and if it ossifies then it will be a problem, right? If it ossifies then it will stick to a place and it will not move. Okay, so that's why epiglottis is the only cartilage which does not ossify. So these were some important one liners asked in the past years, and maybe chances are there that these can be repeated in the upcoming exam also. Like surely one or two questions surely will be coming from this one, and these videos will be mostly like 10 to 12 minutes video, which will help you to recall the important things, and you can watch it in your break time, like tea break, coffee break and all. Okay, so I will try to post such a small 5-10 minute videos so that you will recall a lot of things in a short span of time, and also it will be time saving. So thank you so much for watching this video. For more amazing things, subscribe to GrowMed and join with me on the Telegram channel. The link is given in the description box. And yes, so thank you so much. If you like the video, comment below, share it with your friends and support GrowMed. Thank you so much guys. Bye bye.